When my back was at its worst, a day in life would be very easy. I wouldn't move. A second seemed like a day. It was only a few months in which I really hit my low point, but that seemed to me like 30 years. I had come to a realization that I would never play competitive golf again, and I would never play golf again. I came to accept that, and that was okay for me. I've had a great career. It was done. I would just like to have a normal life. I would just like to be able to play with my kids again. There was a point in my life when I really couldn't do much of anything. It was a tough period knowing the fact that this is how the rest of my life is going to be. I'm gonna have to live this way. That was hard to try and wrap my head around. Can I get to the refrigerator or not? Am I really that thirsty? These are all random things, but that's just how life was.
Tiger Woods is a world-class athlete, and so I should only hope all my patients respond as do world-class athletes. But what was important about Tiger's response is that he had an accurate diagnosis. His pain, they felt, was coming from a very specific disc in his back and was able to address it. And despite the fact that he had had multiple surgeries before on this disc, this operation allowed them in a safe and sound way to directly unpinch those nerves, stabilize those bones, and in doing that, gave him dramatic immediate relief. And that's something we see quite commonly in this procedure, even for people who aren't world-class athletes.
Anterior, meaning from the front. Lumbar, meaning the lower spine. Interbody, meaning between the bones. And fusion, which means to join together. The anterior lumbar interbody fusion, or ALIF, as it is commonly known, is a procedure that has been in use for roughly half a century. Here's how it works. A surgeon accesses the spine from the patient's front via natural separations in the muscles, rather than cutting through the bones and major muscles in the back. Then, the damaged disc is removed and replaced with a spacer intended to restore the height between the vertebrae, or spinal bones, limiting the motion between them and relieving the pinched nerves.
Well, I'm an orthopedic spine surgeon, and so after orthopedic residency in New York, I was a fellow at the San Francisco Spine Center, where 25 years ago I began doing anterior lumbar interbody fusions. So I've been doing them for the past 2.5 decades. I've done hundreds of them in my career. They are a procedure that was one of the first minimally invasive lumbar surgeries. Minimally invasive in that it allows you to operate on what's wrong with somebody without having to injure adjacent structures and keep pretty much normal things normal and just try to fix where the patient's pathology is or where the pain is coming from. The key to surgical success is understanding someone's diagnosis. And if your diagnosis is because of an injury to the disc, or what we call a motion segment, where two bones in a disc meet, then this procedure allows us to focus in on that motion segment and fix it and leave everything else alone in a way that other surgeries don't. The technique has improved, it's very effective, and because we're not cutting people's back muscles, they have a much earlier sense of whether they're better. So very often patients who went to sleep with back and leg pain wake up without that pain. They may obviously have pain from where the incision was, but the center of their pain they can perceive already as being much improved from the moment they open their eyes.
When I woke up from spinal fusion surgery, they encouraged me to stand up. I was like, are you kidding me? Stand up? You just cut me open. Why do you need me to stand up? You know, you're okay to stand up now. It's good. That nerve pain that I had been feeling for seemed like an eternity, it was gone. Like my right leg was working again. That was amazing.
Over the past 25 years, that technology has evolved, and really it's reached its pinnacle currently with the current Sentinel spine device. The materials that they make this device or cage out of allow for the bone to grow into it, thereby enhancing healing and decreasing the risk of non-union or unsuccessful surgery for what we're looking for. So So in many ways, from the technology of the device in terms of its materials, from the addition of fixation, and how its size and shape have all come together to make this technique a more successful and universally applicable technique compared to where it was 25 years ago. And that's why we're able to get patients home sooner, and we see better outcomes with greater certainty now than we ever have in the past.
The nerve pain is gone, and it's been gone ever since the spinal fusion surgery. If my kids want to do something, I can do that again. And there was a period of time which I couldn't do any of it.
For Tiger Woods, regardless of what successes and championships lie ahead, his comeback story is complete. He has truly regained his life.
It is quite remarkable that my life has changed and have come from hopelessness to one of hope and prosperity.